Yeah, so there have been instances, I would say not very common, but there have been instances when somebody has been treated for schizophrenia for several years, in fact, before any movement came in, and therefore the patient was not suspected at all. And the first time some motor symptoms crept in, the physician picked it up. Or of course when there is family history, and so therefore it's always a good idea for a physician to ask for family history, that is there any brain disorder, any neurological problem in your family, so that you get an inkling of whether there is something else going on as well. The other problem here is that many of the, especially the earlier antipsychotics that were used to treat patients of, say, schizophrenia, they also develop a kind of movement problem, which is called tardive dyskinesia, which is a side effect of some of these medications. And that also causes a kind of rocking movement of the head and things like that. So sometimes a physician may get, a little confused. Let's say you've gone to one doctor for 5 years, and then you go to another city and you go to another doctor. And now that person may think, oh, she has been taking treatment now for 5 years, and therefore these may be side effects of the medication. But actually, it could be HD. So a little care has to be taken into what is the kind of movement the patient is showing. If there is something like a uh, choreiform movement, and the test is very simple. There's a genetic test that is there, which is very definitive, so there is no doubt about it. And there are several centers, including Nimans, where the test is done. So it's not a very difficult to do test. So any suspected HD case definitely should be sent for genetic testing.